Ready for joining. I'm going to officially begin. So, welcome everyone to another one of our free monthly wellness webinars. This month, we're going to be talking about cancer awareness and prevention. And as I always like to say, if you came here live and you're hanging out with me while this event is occurring live and in person, thank you so much for being here. If not, that's okay, because that's the whole point about doing these recordings, so that if you've registered, you can always receive the link in the future. And I'll talk a little bit more about this too, because the last time I had my webinar last month, I was kind of saying, I don't know if I'm going to do these anymore. They're very time intensive and they're free, right? So like I'm giving away all the things, but I enjoy providing information, education out there for everyone who doesn't have access to stuff like this. And I feel like it's pretty good quality. So I think what I'm going to do is I'm gonna have to dump something else in my life, like another responsibility, and I have in mind what I probably am gonna let go of. And I think I'm gonna keep these wellness webinars going for as long as possible. I've been doing these for 3 years now, and I'm so grateful for the feedback, and I really enjoy putting these things together. I think, I learn as well when I'm preparing the materials for you, and I hope you're taking away some stuff as well. Okay, so let me get to the heart of the matter. As we said, today's conversation is going to revolve around cancer awareness and prevention. And some of the takeaways for you, hopefully by the end of this, you'll understand a little bit more about some of the common cancers and the way that we have different factors that can affect our risks and outcomes, and also applying some strategies too, whether you are affected by this, somebody who's affected by it. I mean, cancer is, pretty unfortunately common nationally and across the world. So I'm sure we all have something related to this in one way, shape, or form. The housekeeping stuff that you see on screen here, as you heard when you were coming in, the session is being recorded because, like I said, some people will register but can't make it in person, so they'll receive the recording when we are done. And then this also, in a couple of months, goes out to the Dish with Dina YouTube channel so that it's accessible for the public, the general public. I like making sure that people have quality educational information out there. On here too, you can use the chat box if you want to. I'm kind of playing around with like two different screens. So I'm the only one working this presentation. Sometimes I have a student with me, sometimes I have an intern. I actually have a student who's off screen right now, but not working on the presentation with me. So I'm keeping an eye on the chat, and there's always time at the end of the presentation for true Q&A. But as always, this is not medical advice. Please make sure that you are checking in with your own personal, individual healthcare providers if there's anything that you need to do or change around in your health and habits. Okay, at the end of this presentation, usually a few days, probably next week, you'll receive an email, because obviously I'm getting your emails, right? You have your email addresses when you register for these. So I'll send you a follow-up email, and it will have a link to a survey. We love feedback. We also like knowing if there's other topics that you are interested in that we can put on for you in the future. And then you'll also get a link to this recording as well. So feel free to share it and tell your friends about it, and hopefully they can join us next time as well. Moving on to who I am. I didn't even say who I am. I'm Dina D'Alessandro. I'm a registered dietitian, nutritionist. I work mostly out of New York City. Today, I'm actually in my student health center office on campus at Lehman College in the Bronx, which is where I am also an adjunct lecturer and the campus dietitian. So I work with the student population here about 1 to 2 times a week, depending on the semester. And I have a wide variety of people that come to see me. So I'm very grateful for the amount of experiences that I have as a dietitian. You can see all my other stuff listed on here. I won't read it off because those of you who know me, it's a long list of things. I juggle quite a lot of hats. I wear a lot of hats, and I really enjoy doing this. I will say that I'm a second careerer. So I like sharing that sometimes, because what I went to school for in the very beginning part of my life isn't what I ended up doing now. So, be open to opportunities. If you feel you're a good fit, or you notice certain strengths or areas that you want to shift that are no longer serving you, keep an eye open, or see if there are opportunities that come your way that allow you to venture into a different chapter of your life like I did. All right, so October technically is Breast Cancer Awareness Month. It's probably something that you know and have seen quite often with this pink ribbon here. We'll talk a little bit more about the other types of cancers that we're going to share with you today, but October is probably best known for this. The pink ribbon was first introduced in the 1990s as part of what is known as the Susan G. Komen New York City Race for the Cure. And I'll share some organizations and resources at the end of our presentation as well. And Susan G. Komen is pretty well known in the breast cancer world. So when people wear these ribbons, it's really just to draw awareness and encourage people to get screenings and making sure that we can support whatever types of progress there is in the science and the research world to help getting better treatments and early detection. So I'm going to give you a little pop quiz. I don't know if any of you feel like writing in the chat right now. Do you recognize any of the other colors that you see on screen from left to right? I have a dark blue ribbon. Then I have a teal ribbon. Underneath that, I have a yellow one. In the middle there, obviously, that's the breast cancer pink ribbon. To the right, we have this light blue colored one. Underneath that, we have a black one. And then we also have a purple one on the top right. So do you recognize any of these? Are you mostly familiar with just the pink ribbon for breast cancer, but all of these other ones here too represent different types of cancers as well. So feel free to put in the chat if you think you recognize any of these. If not, that's okay, because I'm going to share with you what they are right now. So I'll give you a little bit of background into some of these things. So we have colon cancer. We usually recognize that in March, ovarian in September, bone in July, etc. And some of the things I want to share, I'm not going to go through every single one of these just for the interest of time, but I will focus on a few of them. So for instance, colon cancer, or sometimes it's also known as colorectal cancer, that is the second leading cause of cancer-related deaths in the United States, so it's quite prevalent. But it is very optimistic of the outcome if it's diagnosed in early stages. So we're going to talk a little bit later on too about screenings, but this is something that you would get a colonoscopy for. You might have heard that term before. And there's even some at-home tests that can tell you whether or not you might be at risk for something or if they show some abnormal signs there. Jumping down to, or I should say, jumping over to prostate cancer on the right-hand side, that is the light blue color. We see that acknowledged in September. There's also a Men's Health Awareness Month that goes alongside of that too. I think that's in May or September as well, because anyone with a prostate might be at risk for prostate cancer. And males are usually less likely to discuss their condition, their diagnosis, or even go for regular screenings and doctor's appointments. So this is why we really do encourage early detection and going for those screenings and or exams early and often. All the way on the right-hand side, I wanted to point out pancreatic cancer. That's purple, and we usually acknowledge that in November, coming soon. That accounts for about, I think it's the third leading, I'm looking down at my notes, the third leading cause of cancer-related deaths in the United States. And this is probably most closely related to family history and genetic disorders. So people who get pancreatic cancer, though, might not have a family history of it and still could be at risk for it. So this is kind of the tricky thing. However, we notice there's a lot of the hereditary things, which I'll talk about in a second. Like if you've heard of gene mutations or like the BRCA gene, BRCA, the BRCA1, BRCA2 genes, that's when we're talking about ovarian and breast cancer. We're looking at that family lineage. So it's possible that genetically speaking, those genes in your family are going to put you at risk, even though no one else in your family ended up with this particular condition. So this is why if you need to, going again to get screened, exams, diagnoses early on, and recognizing that if you have, if you need to go for a genetic counseling, a genetic screening as well, that's important to consider there too. Before I move on to the next slide though, I have some notes in front of me that there are so many more of these ribbons and these common cancers that are acknowledged. There's about 57 that I pulled out together. I'm not going to go through all of them. Obviously, we don't see lung represented here. There's brain cancer, unfortunately, and a lot of these have their own color and their own awareness month as well. So let's talk a little bit about what even cancer is, right? So when we're talking about the human body and the genes and the cells, hopefully everything is running smoothly and there are no problems, there's no abnormalities. Our cells by nature grow and multiply and divide, and when they are old and damaged, they deteriorate and they expel or they excrete from our body through, bonus points for anybody who knows this, through a process called apoptosis. That's where they're damaged, they die, and they go off. But if you have an abnormal or cancerous cell, those mutations, that cellular division and multiplication, can be what ends up causing the soft tissues to form, and then we end up what is known as tumors. The tumors can be either malignant, so these are terms you might have heard before, malignant meaning it is cancerous, or benign, which means it's not cancerous, but sometimes even benign tumors can be quite large or in an area like in the brain, in an area where it's going to cause damage that you might end up having to go for surgery, or if the person's diagnosed, going for surgery. When these tumors, these especially the cancerous tumors, when they can travel, so they can go within your body and populate in other areas and regions of your body, that is what's known as metastasis. So when you have a metastasized cancer, that means it's spread to a different part of your body. All right, on screen here, I thought this was kind of interesting because research studies usually update every 2 to 5 to 10 to 20 years sometimes, depending on how much data is collected. And what you're seeing on screen right now is kind of like the predictive 2025 statistics for the most common cancers in the United States. So as you can see, if we were online, you could look this up and there's drop-down menus that you can check out a little bit more about each of these versions. But on the left-hand side, you have cancer cases, like how many cases are being diagnosed through the year, predictive. And then on the right-hand side, unfortunately, how many deaths we expect to see from that. So because I'm coming from New York State comes in about fourth, unfortunately, in both cancer cases and deaths across the country. California is first, Florida is second, Texas is third. I share this only because sometimes there are environmental factors involved, that you might be exposed to certain things that other people across different states in the country are not. And as you can see from left and right, lung cancer is the leading cause of cancer death, usually among males. And among females, females also have lung and breast and colorectal cancers as their top deaths by cancer. So when you see things like cases of and then deaths of, again, this could be just indicative of if people are not getting screened early enough, or they don't catch it early enough, the diagnosis, or the way that things are being treated. Some cancers are a little bit easier to treat and have a better prognosis, a better outcome than others do. Next up here, we have risk factors. So on average, we like to share with you some of the things that are either what are known as known carcinogens. Those are cancer-causing properties that occur, especially in things like alcohol and tobacco. And we also have things like genetics. Like I said, it is gene and DNA related, a lot of the issues that we have around this particular situation with cancer. So it could be in your family history, your genetic makeup. Viruses as well. So if you remember a few months ago, I think we did the liver discussion. So you heard about something like hepatitis, but we're also talking about human papillomavirus, the HPV. These other viruses could potentially put you more at risk for cancer too. And if you've worked with me before, that I try to be very sensitive around the conversation around weight and body composition, but there is a lot of research that shows excessive body fat percentage could potentially increase our risk of cancer as well, because it does put you in a state of inflammation. It can potentially affect insulin, and it can increase the risk of heart disease and diabetes, stroke, etc. But what I have on here as a note is something that we don't often hear about, is even on the opposite end of the spectrum too. Somebody with a very, very low body fat percentage, or who skews on the underweight end of the category of body weight, can also be at an increased risk of things like oral cancer, esophageal cancer, stomach cancer, and lung cancer. So just a quick reminder, if you were with us, I think in February when we did the science of weight, when we talk about this excessive body fat, or the overweight/obese category of the body mass index, what we're really talking about is the spectrum, or the ranges. And again, taking into consideration anybody who has a low fat percentage or on the lower end of underweight, that would be less than 18.5 on that BMI category, or over 30.0 on the BMI category. Body fat percentage, for males, if you are carrying more than 25% of your body composition in excessive body fat, or for females 30% or higher, that can also put you at increased risk for cancers and other diseases. And or a waist circumference that is more than 40 inches for males, or 35 inches for females. So again, I just like kind of defining these things, because when you hear the word excessive, it's like, very relative and vague. All right, don't get too scared about this slide here. These are warning signs. So obviously, when you pick apart some of these symptoms or these items that are listed on the slide, they can mean a variety of different things. This is just more about when you're noticing patterns or things that are kind of unexplained in your body, just to be aware of it. I'm a huge fan of paying attention and keeping track of stuff, right? If you're noticing things that feel a little bit weird or off, just make a note. This way, if there is a pattern, repetition, or it happens somewhat regularly, you can bring that up to your doctor and you can have conversations of when something started, what the onset was, if it progressively got worse or subsided or switched directions in some way. So we talk about things like unexplained weight loss. If you're noticing signs of fat loss, but also muscle mass, like you're noticing muscle wasting as well, that can be indicative potentially of something even deeper that you want to check out. I won't go through every single thing on here because obviously you can read the bullet points on there, but more along the lines of something like fever. Like there's no other signs of infection. You don't know what's going on, whether it's low grade or high grade, it feels consistent and persistent. Obviously, bring that up to your doctor. Persistent pain that can also change direction. We talked about that metastasis before. So it's possible something is traveling from one point in your body to another. So again, things that could be indicative or risking or warning signs of cancer or cancer-like conditions. Skin changes. So we're talking about moles, parts of your body that you might not even be able to see, right? Taking a look in things and seeing if something has a jagged edge or irregular borders or it's changing color or gets darker over time. It's large, it's growing. Again, making notes about that and bringing that up to your doctor, your dermatologist. Certain types of bleeding, if you're noticing blood in your stool or blood in your urine, that can be indicative of an issue with your colon or your bladder. So again, making notes of these things and bringing that up to your doctors as well. Okay, next up here, the way that we diagnose, because when we talk about conditions, I always like to include this stuff too. I feel like sometimes when people go to doctors, they don't know what they're looking at, or they get handed a list of acronyms and they're very confused of what these things are, and or their doctor might refer them to go get tested further. So when it comes to diagnosing specifically cancer or the labs that are around that, depending on your symptoms, depending on the screening test, the results of things, there is no real one single test that can rule this in. It's more a matter of like a combination of these things. So I wrote down a few notes for explaining what these things are. So something like in your lab test, when you go for a blood or a urine test, you're looking at the type of chemistry in your body or what the abnormal values are coming up. Usually you'll see something around what's called a complete blood count. That's your red blood cells, your white blood cells, your platelets, and that can be indicative of infection or something is going on as far as body tissues are concerned there as well, affecting your body. There's also something known as immunophenotyping. So again, another kind of blood or bone marrow type of test that you might take, and that is also done through a blood test. There is also sputum cytology, so you're spitting the mucus that's coming up as well. That can be something that they could be testing as well. And I mentioned also urinalysis that can diagnose kidney and or bladder cancer. The imaging test, so some of these things you might have heard of before, something like a CT scan, that's like an X-ray machine that you go into. They usually inject a dye or other substance and they look in and see what the contrast is in your body to determine where there might be some spots or some abnormalities. Same thing with an MRI that show places where we can see tumors. A bone scan also, again, if you're looking at bone marrow, bone density issues, anything that's spreading to the bones, we want to catch that very quickly. And things like ultrasounds or x-rays as well, because again, you're looking at what's known as a sonogram, you're looking at the imaging within the areas inside your body to notice what's going on there. And then I'm not going to say last but not least, because again, these things can all be kind of in combination, or if one keeps coming up as abnormal, they send you to the next stage of something. So a biopsy is when the doctor will cut out a portion of your abnormal tissue and then send it to a lab and figure out what's up with that. Or they might do an endoscope, so endoscopy or colonoscopy. That would also be part of this category as well. That we treat cancer, I think it's a long way, but there are definitely some very unfortunate things that happen and side effects that can happen. So it's always good to make sure you're talking to your doctor if this is the next step for you, or if you know somebody who's going to be going in for treatments for their cancer. So again, depending on the symptoms, the type, the diagnosis, the cancer that is getting diagnosed, and the different biomarkers, the testing that is used, you might go through chemotherapy, where it's going to kill or stop the growth of those cancerous cells. You might go through immunotherapy, which helps reinforce your immune system, because that is going to be getting affected when the treatments kill off the bad cells. They also sometimes kill off the good cells, and people who are dealing with this diagnosis and these treatments are known as immunocompromised populations, meaning that they are more at risk to end up with an airborne disease, or have, anything like a cold or something can really affect them a lot worse than somebody else whose immune system is very strong and able to handle that or fight back. Radiation therapy is very common as well. Sometimes that's in combination with chemotherapy, where it uses that to shrink the cells and the tumors. And then surgery, so I just mentioned before, the biopsy is just to get the first testing of what those cells or that tissue is like. And then the surgery itself would probably be to remove the tumor entirely. By the way, I didn't say this earlier, but obviously, if this is a very sensitive topic, or you or someone is going through it, feel free to take away from this whatever you want to, or if you feel like you need to step away because it's a little bit too personal or it's a little too sensitive, that's totally understandable. But I hope that this provides you with some guidance, that if you are interested in this, or somebody who's going through, or you've gone through, when it comes to things like the diagnosis and the treatments for it, I have some questions that I'd like for you to ask your healthcare providers going into it. Because again, sometimes they don't tell you what you need to know. You're just kind of following directions, and it can feel really, really scary. So asking them what the type and what the stage of the cancer is, the benefits and the risks. I mean, a lot of times your healthcare providers are going to know that there are side effects that are happening, but they're weighing out the options. Would you rather have the stage of cancer get worse, or would you rather get rid of it and undergo some of these side effects that are not going to be very pleasant, but are short term? So understanding what the kind of cause and effect are of those things. The location too. So there might be treatment centers, or you might be hospitalized. It might be short term, it might be continuous. So again, finding out a little bit more about what it entails. You might not be able to take off all the time from your work, or you might have to make arrangements for childcare or at-home services. So I think a lot of these questions are very useful going into stuff like this. Chances of recovery, know the statistics and weigh your options there too. If something is very rare, or it's very, unfortunate, then you might want to figure out if there are alternative treatments or other things that you can do, or get second opinions and figure out what to do next. Or if something has a great way of recovering, that can put you at ease and knowing what you're getting into before you go in. And then what part of a lot of doctors and dietitians and specialists do is we monitor and evaluate, is the treatment working? So same like you, how will you know? Because a lot of stuff that you might be going through can feel a little bit uncomfortable, but that might be indicative of the treatment is actually working. So understanding what to look out for, so you're not afraid, is this something abnormal, or is this just part of the procedure? I also wanted to give a shout out, speaking of dietitians and specialists, that there are oncology dietitians. That's part of a subspecialty of the registered dietitian world, where they work within either treatment centers, hospitals, or outpatient settings to help support the health and the healing of people who've gone through this diagnosis. A lot of times what we'll see too is, and I'll talk about this in a few slides coming, is the quality and the quantity of the nutrition as well, understanding that there's going to be a lot involved in this. So having somebody who is a specialist in your support team, I think, is very important. All right, I want to stop for a second and also share some myths and misinformation. It's the internet, y'all. We look at social media a lot of times to give us the information, and go on Google and don't maybe get the most correct information out there, or we hear things. We hear a lot of things like you see on screen here. Sugar feeds cancer. Is that true, or is that not true? Well, I think what happens here is there are nutrients involved in creating cells and the development of a tumor. But it doesn't mean that if you end up eating fruit or candy, you're going to put yourself more at risk. Obviously, there are pros and cons to different types of qualities and quantities of food in general, but it's not like if you completely starve yourself of not eating any type of sugar or carbohydrate that you're going to reduce your risk of cancer, or your cancer will disappear. That is not studied and not supported by any evidence. The next thing up here too is organic food. So when you look at conventional food products versus organic food products, we're talking about maybe the use of different kinds of toxic substances or chemicals or pesticides. People think sometimes organic foods will prevent these conditions from happening or prevent specifically cancer. I have a note here that I checked out a 2018 study that I will say, in comparison to those who ate organic, mostly organic diets versus people who did not eat organic diets, they had about 25% fewer cancer incidents in that patient population or in that subjects study subjects in there. But in that study, they mentioned that it's very limited. It has a lot of limitations to it. The pesticides alone is very hard to kind of measure and figure out exactly, dosage. We talked about dosage and toxicity. Like, where is the threshold? How do you measure something like that on a variety of different fruits and vegetables or different organic food products? And there was the language that actually said assessing organic food intake is quote unquote notoriously difficult. So the researchers are doing the best they can with what they've got, but it's very hard to find a specific, confirmed way of saying this equals that. So again, odds are it's not going to prevent it. It'll just hopefully, if you're living a life that allows you to eat organic foods, then maybe a lot of your other habits will also be kind of in check. And that just puts you naturally at a lower risk of these conditions to begin with. But like we said, sometimes it's the luck of the draw when it comes to cancer. The last thing on the right-hand side is the superfoods. Superfoods cure cancer. Well, I mean, if you attend, was it last month? If you attended the nutrition facts label webinar that I think we just did last month, we talked about this word superfoods. There is no official definition of it. It's like used in a lot of marketing, but I think in its basic level, what it is indicative of are foods that are very rich in those oxidant properties and compounds, things that are going to protect our cells. But you can't say something is going to cure it. So you can't just go on, an all broccoli diet and expect your cancer to be cured. That's not going to be something that I would recommend, and that's not something that is substantiated or supported in evidence. But a lot of these foods that we like, these, nourishing foods, different vibrant colors, and the things that we always recommend to eat, which we're going to see in a second too, are desirable. So what I want to talk about here though, because when you look at things like this brings us to the understanding that we as an individual, I as a human, me as a patient, that it's within my realm, it's within my responsibility to be able to support all the things that can reduce my risk of chronic conditions, cancer, and lower my risk of getting those things. But I like to acknowledge what are known as the social determinants of health. It is very unlikely that a single person can be in charge of everything that has to do with their health. And this even stems from things like housing, access to affordable and safe housing, access to quality, affordable, available foods, right? We just got done talking about organic. Organic is quite pricey in relation to conventional foods. And if I've got to spend money on rent and my kids' school, I don't have a dollar extra to go pay for organic blueberries. So now does that all of a sudden mean that I don't, I'm more likely to get cancer or I'm more likely to have a condition just because I don't have the money to support that? I really would hope that's not the case. Education of knowing, again, when screenings are to be done or understanding how systems work, that again is a privilege that a lot of us have that some other people do not. And environmental factors, depending on your zip code or your finances, you might be living in an area that is environmentally unsafe, a lot of pollution or factory settings and so on that could put you more at risk. So again, it's not necessarily in the individual's responsibility, but hopefully a more systemic thing that we can take a look at and really addressing those inequalities as a community, as a whole. Where can we put our funding in? How can we support and make an equal level playing ground for everybody to reduce everyone's risk of chronic disease and cancer in particular? All right, so I'm going to go into our screenings and early detection. So this is going to be a lot. I've broken it down into life cycle stages. So I have some notes in front of me again that I'm reading because cannot memorize any of this stuff. So in chunks of time here, around your 20s or 30s, and it's not necessary that you get tested or get screened, but this is around the time that you should be curious of what your family history is like, or if you've been going to your annual physical exams and getting some feedback, or if, again, if you're not feeling like a lot of your habits are up to par, that you might want to keep in mind you could be more at risk for certain things, specifically around colon cancer, breast cancer, and if you have a cervix, cervical cancer as well. So normally, if you're familiar with what your body looks like and feels like, and you don't notice any abnormalities, you might not necessarily feel compelled to go for a screening or to get tested at that time, but you can have those conversations with your doctor, especially if you have a family history, or when to start getting things like mammograms. Next up, in your 40s, so now we have the added thing in your field for men or anyone in the state of also making sure you're getting checked or having conversations around prostate cancer or prostate screening. So again, what your average risk might be if you are at increased risk. And every year or every 5 years, when you're having these conversations with your doctor, if you've done something when you're 20, 25, 30, 35, then you're probably going to keep doing it when you're 40 or 45. And we'll talk a little bit about that too, of the later years in life, different kinds of screenings and things. I do want to point out here too, like I said before, with questions for your healthcare provider, it's important to know what pros and cons or risks and benefits come with testing. So if you are going to have to go through multiple testing screenings because you might be at risk for something, or because something came out abnormal once and now you're on kind of like that path of always having to go get checked, sometimes overdiagnosis can happen. Sometimes false positives can happen. And I'll share a little bit too about my situation. This can be pricey. Sometimes your insurance is not necessarily covering all of these excess or extra tests. So having those conversations with your doctor, your healthcare provider, your specialist, your relatives as well, finding out if anybody in your family, if you know what your family history is, what they went through, what they might recommend, and weigh out the options too. In your 50s and 60s, we're focusing a little bit more on what you see here. So we've added in lung cancer now too. A lot of people that I've shared, I've confessed I was a smoker for 23 years. I think it took me something like 4 years to quit. So if you have been a regular smoker, or even if you used to smoke around a pack a day, so that's 20 cigarettes, a pack of cigarettes a day, then you might be at risk for lung cancer. So you might want to make sure you're going for lung screenings or chest x-rays and finding out if there's any abnormality showing up so you can catch those quite early. Again, understanding the risks and the benefits. If something is caught early, great. There might be a false positive, going for secondary testing, and understanding that we don't necessarily want you to go through unnecessary treatment. Like, we don't want radiation to happen if that's offered to you, if there could be other options or a second opinion, because we don't want your body to go through that if it doesn't have to be. So making sure you're having those conversations with your doctor as well. And then we come up to about 65 years and older. So now we enter into the age range that, if hopefully you're covered by Medicare health insurance at this point. But even so, sometimes depending on how old you are, like I have a note here that colon cancer screening testing is recommended through the age of 75. And then after that, and even most people older than 85, they usually say don't even bother doing it anymore because it's not really worth going through it, and you don't have to be screened any longer. If you've come out clear in those earlier years in life, the risk factors reduce, and it's not as an option anymore. Again, if you've been a smoker, that's something you want to check out too. If you used to smoke, etc., that might be something that you're going through, again, every 5 years or so, screenings and checking that out. Breast cancer, so mammograms, that's a conversation again to have with your doctors, your specialists, your technicians. Usually it's recommended every 2 years, but there are pros and cons of going through those imaging. So one of the things I wanted to share, we have breast cancer that runs in our family, like everywhere. And I've never been tested for the gene, the BRCA gene that I mentioned earlier. But I have had some abnormal breast exams come back, and I've had some dense breast tissue in my mammogram. So they've sent me for other imaging. And the last thing that I had gone to, because I come in at my age and with my family history, I'm listed as high risk. And so the lab had called me, and the doctor's office had called me and said, we'd like you to go in for this imaging thing. I was like, okay, fine. I asked if it was covered by insurance. They told me it was. It wasn't, at least not in full. So out of pocket, I ended up having to pay $350, which I was not really aware I was going to do that. So again, asking, getting information, insurance companies in the United States, they have their own opinion and kind of like algorithms as to what they will or will not cover. So I think that's important to know going in. I didn't think I needed to get this thing, but I went anyway because I'm at high risk and and now it put me behind quite a pretty penny there. So again, just encouraging all of you to check into what it is that you should be aware of. A lot of people don't go to the doctor very regularly, which, I try to make sure that you do go and have conversations with your doctor. Sometimes you're in and out in 7 minutes, but inquire. Around this time I should be getting this. Around this time I'm curious about whatever. I've noticed these things in my family and have conversations with you. So please make sure you're spending time with your healthcare providers and discussing that well as well. All right, some general recommendations. I mean, this is super general going on here. You've heard me say it before, friends, and I keep saying it. Stop smoking and drinking. Easier said than done. I know, I get it. If you're a smoker, I've been there. It's very hard. It's very challenging to let go. If you're a drinker, and even if you enjoy social drinking, the general guidance right now is if you've never drunk, don't start. And if you are drinking, please consider stopping or really reducing it. These tobacco and alcohol, as I said in the earlier slide, are known carcinogens. They are class 1 carcinogens, means they're cancer causing. How much of too much is anything we don't know that. I don't know if one cigarette's going to do it for you or, 6 bottles of beer are going to do it for you, but the more you can lower your risk, the better. The second thing here too, which I mentioned earlier, the maintaining a healthy weight. So when you define that, it's really more about, are you dropping and gaining, dropping and gaining? That puts us at metabolic risk. So don't be on these fad diets because you're trying to get beach body ready or you're, new year, new you kick in, and this is the year that you're going to be the size you were in high school. Be very, very careful what you're doing to your body composition and how you're approaching these things. So more often than not, it's not just about what end of the spectrum you are on the body mass index. It's more about how long have you been there? Is that just a comfortable weight for you? And is it something that you can sustain? And of course, if you have lab values, blood tests, etc., that are coming back okay, then you might not have to drop anything or change your body weight. But if you are being told that by your doctor, or if you're having conversations with your dietitian, or if you yourself want to, get out of what you think might be the danger zone, sometimes there's a therapeutic approach to it, which we discussed also in that Science of Weight webinar back in February, where something like, depending on where you're starting from, even something like around 5 to 10% of your body weight, and technically we're talking about percentage body fat, not muscle. We don't want you dropping muscles. That could get you out of the danger zone. So sometimes even something like that, again, slow, steady, realistic, sustainable, might put you in a better position. Move what you can. I always try to say exactly that. If you have limitations, if you have mobility issues, modifications you need to make, again, move what you can. If you're sitting down and just doing exercises with your arms or dumbbells, if you have a physical therapist, or if you're out there and trying to move, in New York City, we always go, okay, everybody goes from the subway to whatever they're doing next. What can you do in addition to that? Getting that heart rate up, if you're medically cleared to do so. Don't do anything that I say unless you make sure you're not going to be putting yourself in harm's way and get any injuries. But try to see if you can do a little bit more, right? Get that oxygen flowing after the age of 35. There's a lot of wear and tear going on in our bodies. So, the more you can kind of be active in however you can, the better for you. And then on the right-hand side, which I'll talk a little bit more in a second, is diversifying your diet. What is healthy eating? Well, it's getting as much variety as you possibly can in well-balanced meals. So we just had conversations today with some of the patients that were in to see me at the Student Health Center about what can you add before you worry about getting rid of something. What can you add to your diet? What are some of those nutrient-rich foods, whole foods, minimally processed, again, within reason? We need to be convenient, and not everybody wants to cook from scratch, which is totally understandable. But what can you prioritize as far as good quality proteins, healthy fiber options? Hydration is a big one too. So I'll give you some visuals now. I'll show you some pretty pictures that you can take a look at and see if you want to fit in any of these things as you're creating your meal plans going forward this week or as you move through the rest of this year. To start off, we're talking about eating the rainbow. When we talk about that, we really mean, are some of your food items really richly colored? Because that means that is antioxidant rich. These are things that helps protect your cells. Things like you see on screen there, right? Berries, leafy greens, those cruciferous vegetables too, whether you like broccoli or cauliflower or kale or spinach or Brussels sprouts, those things contain substances, chemical, naturally occurring plant chemical substances that help support our kidneys and our liver in detoxifying, right? Getting rid of all the bad gooky stuff that's in our body and can help potentially prevent some of that bad cancer cellular growth. Next up, choosing whole grains and adding fiber to our diet as well. A lot across America, we don't get enough fiber. A lot of people fall short in this. And it's not just about eating broccoli and leafy greens. You can get things out of things like avocado has fiber in it, nuts have fiber in them, anything with a skin, your produce, if it has a skin that you can eat without peeling, beans, legumes, lentils, etc. Those things are really good too. So think about where you can swap out or add in. Again, you're supporting your gut health when you're adding fiber. You're helping with cholesterol levels as well, managing that too. It helps keep you satisfied and fuller. And I recognize it might keep you gassy and a little bit bloated. I get it. So maybe not everybody's favorite thing to eat, but when you increase fiber, make sure you're also increasing your fluid so you don't get constipated. And this also provides you with a slow and steady energy level. So this is also now supporting insulin and hopefully putting you less at risk, not just for cancer, but also for things like diabetes as well. And reducing that overall inflammation we mentioned before. And then healthy fats. So we're talking about, before you see what's on screen here, we're also talking about opting to eat less of the red meats, saturated fats, and those really heavily processed types of foods like bacon and sausage. I know all the fun stuff, bacon and sausage, and even cold cuts. Sometimes the cold cuts are not great quality. And bringing in some of those things like salmon and tuna, and if you are not allergic to it, adding nuts or seeds to your meals, something like avocado. I mean, I'm an avocado fanatic, I think. So bringing in avocado if you can afford it and making sure it doesn't go rotten before you're about to use it, that has anti-inflammatory properties as well and can really help with supporting your overall health and potentially reducing your cancer risk too. The next thing I want to share too, so I teach a lot of different classes here at Lehman College in addition to being the campus dietitian. And some of the things we talk about are case studies. So we use like fictitious patients and we teach the students how to help support them. And when you're undergoing something specifically, like we're talking about today, if somebody's undergoing a diagnosis of cancer or treatments for cancer, not just supporting them socially and through food and nutrition and meeting with their specialists to make sure, their treatments are working, but also recognizing that some of these things can really, really fatigue people. It can cause some pain or discomfort. So they might not even be able to lift a fork to their mouth or chop and slice vegetables or meal prep for themselves. And like I said before, some of the stuff might be out of pocket or they're going to multiple specialists. So either they're paying for their treatments or their visits, or they're taking off of work and not getting paid for work. So again, this can put a lot of stress on people, and stress is something that can also affect inflammation and it can affect our overall health and wellness. So the more you can support people who might be going through this diagnosis, bring them some food, ask them what their favorite things are, texture-wise, what they can chew and swallow, easy to digest things. They might have to eat small, frequent meals because they might not be able to sit down and have like a proper full meal, understanding, just to meet them where they're at and support them however they need. So speaking of support, here are some organizations and resources for you. I didn't put everything down on this slide, I just realized. So we have the American Cancer Society. Obviously, you can Google these things. They're all usually .org or .gov sites. You have the Livestrong Foundation. You have the National Cancer Institute down on the bottom. Susan G. Komen, I mentioned earlier, who was kind of like the initiation of that pink ribbon way, way back in the day. The Colorectal Cancer Alliance, so a lot of these specific cancers have their own version or their own organization or resources for that particular cancer. And also in your community, look for local screening programs that might offer low cost or free options there as well. All right, friends, we are wrapping up. So thank you so much for hanging in there and being here with me at the end of every webinar. I always like to ask, what are your takeaways? What are things that you think you might want to start, keep, or stop doing? Maybe you start adding some cruciferous vegetables to your diet. Maybe you keep going to those screenings and checking in with your doctor. And maybe you stop some of the habits that might not be serving you anymore, like drinking alcohol and smoking tobacco. So think about some of the things that you can do for yourself, commit to yourself going forward for the rest of this year and the years beyond, and anything else that you want to share with your friends and family. We have next month is Diabetes Awareness Month, so I am going to do a diabetes webinar on Thursday, November 13th from 12 to 1 p.m. Eastern Time. So when you get the feedback link and the recording and all that stuff from today's webinar, I'll also include the link to register for that as well. I've been checking the chat. I don't see anybody talking in there, so if you want, I can spend a few more minutes hanging out if anybody has anything else they'd like to share or ask. And if not, that's totally fine. I will give a shameless plug, but a very proper plug. Like I just said earlier, the recordings that we do for these wellness webinars do get posted a couple months later to the Dish with Dina YouTube channel. I would love for you to go there, subscribe, like, share. I mean, we put so much effort and energy. I've said this before. I think this 1 hour webinar or these 1 hour webinars take me somewhere like 6 to 10 hours to put together. And I go through a lot of research, and sometimes I have students and interns helping me, and sometimes I'm flying solo, but they're all there available to you. I would rather you send people to my YouTube channel than Google and ChatGPT things. Just make myself feel better. If you'd like to work with a dietitian, if I'm able to help you, you can check me out on DishWithDina.com, learn a little bit more about my services. I take a wide variety of health insurances, and I can work across a handful of state lines if you want to work with me virtually. So for, virtual telehealth, I'm available to do that. All right, and I just want to give props. Thanks to all of the researchers, the organizations, the programs, the schools, the foundations out there that I utilized to create this webinar. I hope that you enjoyed it and you got some good takeaways from it. My friends, I hope I'll see you again soon in the next one. Please eat well and take care of yourselves. Be well, everybody.